Welcome to the Retreat Radio, where we go beyond temporary fixes and surface-level symptom management. Here, we dig into the real root causes behind your symptoms so that you can understand your body, advocate for your health, and ask the right questions. I'm Heather Witt, physician assistant and owner of the Retreat Wellness and Aesthetics. This podcast sits at the intersection of aesthetics, longevity, and functional medicine, and you'll get information without the sugarcoating, the trends, or the nonsense fluff. Let's get into it. Hello, everybody, and welcome to the Retreat Radio. And today we are going to be talking all about hormone therapy, specifically for women. And we're going to be covering the WHI study and really what that did to the trajectory of hormone care for women. We're going to talk about some of the shortcomings of that study. We're going to talk about what some of the new data is showing. And since I made the outline for this episode, something really exciting happened. So the black box warning has been removed from estrogen therapy for women. So we're going to talk a little bit about that as well. So let's just jump right in. Let's not waste any time. So why this topic is so important to me is because what hormone therapy can do for people is just amazing. Getting your hormones balanced is really the base of everything else in your body. So a lot of other treatments and things you can be doing are going to help. They're going to help you to feel better. But if your hormones are still not optimized, that creates a problem and you're not going to feel your best. And the problem with this is that there's not a lot of great resources for hormone optimization. For instance, like in our clinic, when we run labs, the labs come back with like a little recommendation of like, okay, here's the normal range. The problem with that is that those ranges take into account average population, which includes a lot of sick people. It includes a lot of old people, and those aren't truly optimized lab values. So when you go to your general practitioner, you go to your OBGYN or, PCP doctor, oftentimes they're using those non-optimal ranges. And so when your labs come back, they're like, oh, everything looks fine. And really it's not. So I think like typical range on a lab for male testosterone is anywhere from like 150 to like 400. So if you're sitting at like a 350, it's going to say that you are normal. And that is far, far suboptimal. There really is this need for better education on what true levels should be. And part of the problem this stems from is this WHI study. This was a study that was done back in 2002. There are a lot of flaws in this study. However, the findings that were said to be found in this were extrapolated and fear-mongered into the community, and generations of women did not receive the hormone optimization therapy that they needed for fear of cancer. So let's jump right into what some of those flaws of that study were. So there were three main flaws. The first flaw is that they used the wrong hormones. And this is probably the most important thing that we need to take a look at. So this study used synthetic hormones. So they used conjugated equine estrogen, so Premarin. So this is derived from pregnant horse urine. And then they use medroxyprogesterone acetate, which is a synthetic progestin. Progestin is very different than bioidentical progesterone. So when we're talking about hormone therapy that, we do these days, we're typically talking about bioidentical hormone therapy. So we're using estradiol and we're using progesterone, and that's very, very important. The second flaw of this study was that they used the wrong population. So the average participant in the study was 63 years old, which is like 10 plus years past normal menopause age. And we know that starting hormone therapy 10 plus years outside of menopause onset can be a little bit tricky, a little bit risky. It's still doable, but it's something we have to watch out for. So when that was the general population of this study, we're going to get kind of skewed results. A lot of these women as well were very sick, unhealthy. They weren't optimized in other ways. They had thyroid issues, cardiovascular issues. So all of this plays a really big role in the results. And then the third big flaw of this study was the wrong delivery method. So again, we have the wrong type of hormone therapy and then the wrong delivery of it. So in the WHI study, they used oral estrogen. oral estrogen is not something that we typically would go for these days. We're going to use more like a cream or a patch. The oral estrogen goes to your digestive tract and it gets metabolized by the liver before it actually gets into your circulation and your body is actually able to use it. So it goes through what we call this first pass effect. And that increases the production of clotting factors and a lot of inflammatory proteins. So this increases your risk of blood clots and stroke. And this is exactly why this is a risk factor that we always talk about when we talk about using birth control, because birth control uses these oral estrogens. Like I said, the estrogen therapy that we're more using these days are going to be transdermal patches or creams or even pellets. And they, again, are bioidentical estradiol. They're going to bypass your liver entirely so you don't get those same risk factors, the clotting and the strokes. I want to take a really quick pause and I want to just quickly cover the importance of knowing how to evaluate a piece of literature or a study. This is something that we actually learn in school. So in med school, we learn this in PA school. It's very important that you know how to look at the way that a study is performed and the way that they evaluate those results to know if that's a well-designed study or a poorly designed study. A lot of studies will come out, people will look at that data and they'll just believe everything it says. So when we know how to properly evaluate a study, if we take that and then we actually go back and we look at that WHI study, we can see what that study actually found. There are two main groups. So if we look at the group of women who had had a hysterectomy and they received the estrogen therapy only, and again, remember, this is synthetic oral estrogen. They did not receive any progestin therapy. When they had just the estrogen, they actually saw a lower incidence of breast cancer and mortality rate than in the placebo group. Their coronary risk was neutral to slightly improved, so not much change there. So what this kind of tells us is that the estrogen therapy alone was not harmful, even in the synthetic version, and it actually appeared to be a little bit protective. Now, on the flip side, if we look at the group who received the estrogen and the synthetic progestin, the Provera, these women had a modest increase in breast cancer risk at about 5 years. They had increased cardiovascular events. They had increased dementia risk, but they did have a reduced fracture risk over the age of 65. What we can deduce from this is that really where the issue is coming from are those synthetic progestins. That is really the culprit of all of this fear mongering of cancer risk and all of these other like harsh things that people say about hormone replacement therapy. So how does this then extrapolate to the problem that we're having today? The data from this study that found that really it's the progestin that caused the issue was extrapolated, and people freaked out and they ran to the tabloids and the headlines were reading hormone replacement therapy increases breast cancer and heart disease. And everyone freaked out. Doctors all around the country pulled all their patients off of hormone therapy. Women were scared to death to go on it. They were scared that they were going to get breast cancer. And then they had years and years and years of horrible symptoms and changes in their life. So what that did is it basically lumped together all hormone therapy into one bad category instead of realizing what that study actually found, and that the problem is that it's really the progestins, and that actually estrogen therapy on its own, even in a synthetic oral version, is just fine and did not increase that breast cancer risk. So that really led to this cascade of such a horrible 23 years of care for women in the United States or all over. Let's take a moment then and let's look at what the newer research is actually showing when we're starting to actually do studies that involve bioidentical hormones in different combinations, because this is really what we are interested in, since this is really how we're practicing these days. Most studies these days are looking at bioidentical hormones. So they're looking at bioidentical estrogen plus progesterone. And they're looking at transdermal, so like a cream or a patch, or a pellet version of estrogen. So that's going to include estradiol and estriol. And then they're looking at the oral progesterone or prometrium for your progesterone combination. So when these two are taken together, generally if you're on an estrogen, you need to be taking progesterone as well for uterine protection. But one caveat to that is you have progesterone receptors everywhere in your body. So even if you don't have a uterus, if you are on estrogen, you really should still be taking progesterone to protect your entire system. Studies are finding that when these two are used in combination, there is no increased risk of breast cancer. Actually is some protective findings being found, and that actually it's reducing reoccurrence in people who previously had breast cancer. The risk continues to be found only with using synthetic progestins. So again, not even with estrogen alone. There are more and more studies that are being done, more and more things that are coming out. So this is really, really exciting thing for hormone therapy. And I think we're going to see, especially now with that black box warning taken off of estrogen therapy, we're going to see an explosion in hormone therapy and so many more women getting the help and the symptom relief that they need. Just a little bit more on progesterone, because progesterone really is such an important factor when you are talking hormone therapy replacement. So even though we have found that estrogen therapy alone can be safe, even protective, progesterone is essential for getting true hormone balance. So a lot of people, think that they are having an estrogen problem. And so they go to their doctor and they get more estrogen. What's really going on is a lot of times we get into this estrogen dominance. So we kind of have this seesaw. And so if your progesterone starts to get too low, and by the way, it is the first hormone that starts to decline in women, when that starts to get too low, it makes your estrogen seem much more than it actually is, because you have this teeter-totter effect because you're not balanced. So what we're trying to do with progesterone is we're actually trying to balance out your hormones. So without that piece, you can still be in a really misbalanced state and not be feeling your best. We already talked a little bit about how progesterone is also still very protective on the uterus, as well as many other tissues in the body. It is really important that anytime you are on an estrogen, you are on a progesterone as well. And again, progesterone, not progestin. One thing that we see all the time is women go in and they complain they're not sleeping, they're having heavy periods, they're having like emotional issues, all of the things that happen when your hormones are unbalanced. And what do providers do? They put them on a birth control. This is literally one of the worst things you can do. Birth control is synthetic progestins and synthetic estrogens. They're oral estrogens. And when you take a birth control, you're not balancing your hormones. You're shutting them down. When you take these synthetic birth controls, they are at such a high dose that they literally shut down your entire HPA axis of your hormone cycle. And this can be very detrimental and not actually help your symptoms. It's basically like putting a Band-Aid on it, but not actually fixing the problem. So we want to reach that true harmony, that true balance. And this is where using bioidentical hormones and balancing them, it's a really fine-tuned process to get you feeling your absolute best and to actually fix the core root problem. All right, so let's just do a quick recap, because I know that's a lot of information. A lot of it can be really confusing. There's a lot of different resources out there. There's people saying lots of different things and having different takeaways. But basically, the WHI did not prove that hormones cause cancer. What they proved is that synthetic progestins can increase the risk of breast cancer. It did not show that estrogen can. It did not show that progesterone or bioidentical hormones can cause it. And actually, new studies and new literature is showing the exact opposite. And what I'm really excited is that BHRT is now, or bioidentical hormone replacement therapy, is now going to just skyrocket. And I'm so excited to be able to help so many women and men to feel so much better and kind of realize that this is not normal life. This is not, I'm getting older. This is menopause. This is what's going to happen. I have to accept this. I'm going to get tired. My sex life is going to die. No, that does not have to happen. And we do have solutions and we do have answers, and we have safe solutions and answers. So if you or anyone you know are struggling with any of this, you want a second opinion, you want to have access to this, but your medical provider is not giving it to you, or your insurance company is not covering it, get a second opinion. Come see us at the retreat. This is what we do. This is what we specialize in every day. And we really want to help everyone to feel their best. And we want to get to the root cause of your problem, not slap a Band-Aid on it. So I hope that you guys enjoyed this episode. If you have any additional questions about it, go ahead and send us a message, email us. You can find out how to contact us in the description of this episode. And I look forward to seeing you guys next time on our next podcast. Have a great rest of your day. The information shared on this podcast is for educational purposes only. It reflects clinical experience and opinion and is not intended to serve as a diagnosis, treatment plan, or medical advice. As always, please consult with a qualified healthcare provider before making any changes to your health, medications, or treatment plan. If you want to be a part of our community, make sure to follow us on Instagram at theretreat.wellness and theretreat.aesthetics. Thank you so much for spending part of your day with me today, and until next time.